Well, welcome everyone. Good morning or good afternoon, depending on where you are. I'm so excited that you are with us here today. I'm really interested to see how we might address those challenges that you raise and increase the likelihood that either open as a network or individual organizations within the network can become more successful in seeking grant resources. It was my privilege to be the Deputy Administrator of the Health Resources and Services Administration for 6 years, and at HRSA, we got between $8 and $11 billion worth of grant dollars out the door every year. So great that I can bring some of that experience and share that with you. Let me talk with you a little bit about what we hope to accomplish today. We're going to be having a discussion about a high-level overview of federal funding for those folks for whom this might be a new area of engagement. Talk a little bit about some of the HHS agencies that currently do fund oral health activities and provide you with some examples. We'll talk about where to find funding opportunities. If you have this great idea, where can I go to find resources to support it? Many of the funding opportunities require you to have partners. And so where do you find those partners and learn a little bit about how successful they might be at gaining grant resources by going to tags. We'll get to hear some great presentations from folks who have been successful at gaining grant resources who are currently in the network. And my former colleagues from HRSA have put together a really interesting program about the basics of grant administration with you in mind. So hopefully you'll find that really useful. And we could go to the next slide. So this is just the 60,000 foot level overview of grants. There are two types. There's competitive, which means that you write your application and you are compared to others, and the ones that look like they're most likely to be successful are awarded some resources. Or there's formula, which means that because you are a state or a community, you get X amount of resources based on your population or some other variable. So that's types of funding. And then types of grants. Most of us are familiar with the kind of grant where you apply and you describe the activities that you're going to carry out, and those are responsive to legislative purposes in the authorizing language, and you do what you say you're going to do. And this is generally awarded through a competitive process. So let's say HRSA opens a funding opportunity announcement, and 50 organizations apply for what's basically going to be 20 new grants. So that's that process. Another kind of grant is a cooperative agreement where you as an organization apply to an agency and say, I'm going to do this activity in response to your solicitation, and we will do this together. So it's an ongoing engagement. It too is generally awarded through a competitive process. And then there are block grants that usually go to by formula to a state or locality. And then there's something that you hardly ever see called a sole source. In that situation, there's usually only one logical vendor. So let's say you wanted to work with community health centers, the logical vendor might be the National Association of Community Health Centers, because that's the only entity that has those relationships. The other way that you can get federal funding is through contracts. We're going to be focusing on grants today, but contracts are generally a federally defined set of activities or products. So you might win a contract with HRSA to hold a meeting for them or produce a document for them. But today we're going to principally be focused on the other kind of grant that you receive through a competitive process. Okay, next slide. These are some examples of federal agencies and the kinds of oral health funding opportunities that they have. I'm a little HRSA heavy, but I spent a great deal of my career there, so I know this agency really well. There are Title VII oral health workforce training grant programs. Perhaps you have heard of grants to states to support oral health workforce activities, or training grants like the postdoctoral training in general pediatric and public health dentistry. those are in the Title VII, and they're in the Bureau of Health Workforce within HRSA. Both the Federal Office of Rural Health Policy and the Bureau of Health Workforce have oral health research grants that take a look at the capacity of the workforce, other issues related to oral health. Within the Federal Office of Rural Health Policy, there are rural health outreach and network grants. And these are really interesting because what happens here is generally three entities that are located or serving a rural community address an unmet need. So these grants may address unmet behavioral health needs or primary care needs, but they also, some of them address unmet oral health needs. So that's an opportunity too, particularly if you are located in and or serving a rural community. HRSA also supports the community health centers. Most folks are familiar with the CHCs. Many of them have oral health infrastructure within their facilities. Some of them are contract out. Every once in a while, there are substantial resources for an expansion of community health centers. That happened several years ago, and they add capacity and they're able to see more individuals and serve their communities more effectively. And then the maternal and child health program has a lot of oral health work that takes place principally to states, but also with other kinds of grants like home visiting or Healthy Start. And they also support a really terrific technical assistance center that provides resources to new moms and their children. CDC makes most of its funding available to states, which is why my example from CDC is state actions to improve oral health outcomes. And the next slide. So this is the technical part. Where to find those funding opportunities. If you go to grants.gov, it's a searchable data set. It will list what's currently available in funding opportunity announcements and also previous grant opportunities. It's managed by HHS. It's all of government, and you can search by keywords. So you can go in and search by dental or oral health or other topic areas, and it should pull up either current or previous grant opportunities. It will tell you the number. Every grant opportunity has a number, what the name of the grant opportunity is, what agency is managing it, and whether there's going to be a competition this year or not. And that's the link. And then the other thing I think you might want to do is spend a little time wandering around in TAGS, which is Tracking Accountability in Government Grants System. And what TAGS does is identifies all these grantees and their financial information. So you can go in and see whether or not NA and PHI ever got a grant. And so you can search by that organization. So you can search by recipient, you can search by site and state. And so there are a number of ways to conduct a really advanced search. And so let's say you are planning to apply for a grant, you need to have some partners. Who else has been successful? How can I improve my track record? By having some partners who've really in the past been able to get federal funding. So TAGS is an important place to go. And you can also search within operating divisions. So you can search within HHS. So these are some of the key things to know as we begin this work. And this is really high level. I'm looking forward to hearing from my colleagues from HRSA, some of the more detailed descriptions of how you do this engagement. The one thing that I think we'll do is try to get back and answer as many of these questions from the chat as we possibly can when we have an opportunity for Q&A.